Hey there, cat guardians! We all know that cats are amazing, curious creatures. But sometimes their adventurous spirits can lead to tummy troubles, and diarrhea is one of those common issues that can pop up. It's normal to worry when your feline friend isn't feeling well, but don't panic. Most cases of diarrhea are easily treatable and resolve quickly, especially with a little help from you and your trusted veterinarian. Diarrhea is a pretty common problem in cats, and while it's usually not an emergency, it's definitely something you need to keep an eye on. It could be a sign of something minor, like a recent change in your cat's diet, or it could indicate a more serious underlying health issue. The good news is that by being informed and proactive, you can help your furry friend feel better faster and prevent future episodes of diarrhea. Remember, every cat is unique, and what works for one might not work for another. It's always best to consult with your veterinarian to determine the best course of action for your feline companion's specific needs. With a little bit of knowledge and a lot of love, you can help your cat live a long, healthy, and diarrhea-free life. Alright, so we know diarrhea isn't exactly a walk in the park, but how can you tell if your cat is actually experiencing it? Well, it's not rocket science, but there are some telltale signs you can look out for. The most obvious sign is, of course, loose, watery stools. Normal cat poop is usually firm and log-shaped, but with diarrhea, it'll be much softer and might even be liquid. You might also notice an increase in the frequency of your cat's bowel movements, and they might have accidents outside the litter box. Keep an eye out for any straining or discomfort while your cat is doing its business. Other symptoms like vomiting, loss of appetite, lethargy, blood in the stool, or a black tarry appearance to the stool are all red flags that require immediate veterinary attention. Remember, early detection is key when it comes to treating diarrhea effectively. So, if you notice any of these signs, don't hesitate to contact your veterinarian for advice. Now that you know what to look for, let's talk about some of the most common reasons why your cat might be experiencing diarrhea. Knowing the cause can help you and your vet figure out the best way to get your furry friend back on track. One of the most common culprits is a sudden change in diet. Cats can be creatures of habit, and their digestive systems can be quite sensitive. Switching up their food too quickly, even if it's to a higher quality brand, can upset their stomachs and lead to diarrhea. But it's not just food that can throw their tummies out of whack. Allergies, parasites, bacterial or viral infections, stress, toxins, chronic diseases, certain medications, and even foreign objects lodged in the digestive tract can all cause diarrhea in cats. That's why it's crucial to work with your vet to determine the underlying cause and get the appropriate treatment. While most cases of diarrhea in cats are not life-threatening and can be managed at home with your vet's guidance, there are some situations where immediate veterinary attention is crucial. Knowing when to seek emergency care can make all the difference in your cat's recovery. If your cat's diarrhea lasts for more than 24 hours, it's time to call your vet. This could indicate a more serious underlying issue that requires prompt medical attention. Other red flags include blood in the stool, black, tarry stools, frequent vomiting, lethargy, loss of appetite, or signs of dehydration, such as sunken eyes, dry mouth, or decreased skin elasticity. Remember, cats are masters at hiding pain and illness, so any changes in their behavior or bathroom habits should be taken seriously. When in doubt, it's always better to err on the side of caution and seek professional veterinary care. So you've determined that your cat's diarrhea warrants a trip to the vet. Now what? Well, your veterinarian will act as a detective using various tools and techniques to determine the underlying cause of your cat's tummy troubles. The first step is usually a thorough physical examination. Your vet will check your cat's overall health, listen to their heart and lungs, and palpate their abdomen to check for any abnormalities. They'll also ask you about your cat's medical history, diet, and any recent changes in their environment or routine. Depending on their initial findings, your vet might recommend further diagnostic tests, such as a fecal examination to check for parasites, blood work to assess organ function and rule out other conditions, or even imaging tests, such as X-rays or ultrasounds, to get a better look at your cat's digestive tract. Once your veterinarian has identified the underlying cause of your cat's diarrhea, they'll recommend a treatment plan tailored to your cat's specific needs. Treatment options can vary widely depending on the severity of the diarrhea and the underlying cause. In some cases, Simple dietary changes might be enough to resolve the issue. Your vet might recommend a bland diet for a few days, consisting of easily digestible foods like boiled chicken and rice, to give your cat's digestive system a chance to rest and recover. They might also prescribe medications to address specific issues, such as antibiotics for bacterial infections, antiparasitics for parasites, or antidiarrheal medications to slow down gut motility. In more severe cases, hospitalization might be necessary to provide intravenous fluids and supportive care. Fluid therapy is crucial for correcting dehydration, which can occur rapidly with diarrhea, especially in kittens and senior cats. While it's not always possible to prevent diarrhea in cats, there are some things you can do to minimize the risk and keep your feline friend's digestive system happy and healthy. One of the most important things is to introduce any dietary changes gradually. Instead of switching your cat's food cold turkey, mix the new food with their old food gradually over a week or two, increasing the ratio of new food to old food each day. This gives your cat's digestive system time to adjust to the new food and reduces the likelihood of digestive upset. Regular deworming is also crucial for preventing parasitic infections that can cause diarrhea. Talk to your veterinarian about an appropriate deworming schedule for your cat based on their age, lifestyle, and risk factors. Seeing your cat suffer from diarrhea can be concerning, but remember, you are not alone. By understanding the common causes, recognizing the symptoms, and seeking prompt veterinary care when necessary, you can help your furry companion get back to their playful, mischievous selves in no time. Remember, this guide is just a starting point and should not be considered a substitute for professional veterinary advice. If you have any concerns about your cat's health or are unsure about the best course of action, please don't hesitate to reach out to your trusted veterinarian. They are your best resource for ensuring your feline friend lives a long, healthy, and happy life.